The other thing that is really kind of another hot topic in holistic dentistry is the whole concept of doing root canals. So root canals, I'll show you what a root canal is. I don't draw very well, so just bear with me, okay? So if this is a tooth, right? If this is a tooth, let's say this is the tooth, this is the top of the tooth, and this is the bone, right? So the tooth sits in bone like this, right? It sits in the bone like that. What happens is with all of our teeth, we have like a canal here. So in here is like your nerves, the blood vessels, your arteries, your veins, and it connects to the rest of the body. So this is like for all teeth, right? So what a root canal does is that this canal here, they take all of that out. And the reason that they do that is if you, let's say you break this tooth, it goes in here. This is like your nerve chamber, right? So let's say you break the tooth and it goes into the nerve chamber like that. So they would take all this nerve out, all the nerve, the blood vessels, all the nutritional supply of the tooth. They'll take it out and they'll replace it. Then you replace it with like a filling material, right? So you put a filling in here. So that's what they call a root canal. So what happens is that holistic dentistry or dentistry says that, or their research has shown that this is like the main nerve trunk, right? But what happens is they also have what they call accessory canals. So there's thousands and thousands of these little canals that go in here like that, which this thing doesn't take care of, right? So thousands and thousands and thousands of these. And then what ends up happening is that you get like bacteria built up in here. And because you've now taken away the connection of the tooth to the rest of the body, because it's no longer here, your immune system can't attack that bacteria. And what happens is this bacteria gets very, very strong, and it ends up coming out this way, right? And it ends up going throughout the rest of your body. So that is the issue that they have with, that is the issue that you have with root canals. What the root canal does is that it allows you to keep the tooth here though, but you end up killing what's down here. But what happens is the tooth is just like any other part of your body. It's like a living, breathing part of your body. It's just like, you know, you having your pinky here and it's broken, and the nerve, you take out the nerve supply. What your body would do is your body would want to start to try to get rid of it, because it's no longer part of the whole system. It's no longer part of your body. So that's when you start to get the gangrene. It'll eventually, actually, if it happens with your pinky, it'll start to fall off, is what would happen. The same thing starts to happen with this. A lot of these teeth end up breaking because they're just so brittle. And what happens is that they say you have to put a crown on here to make it, to protect the tooth, because it gets so brittle, because it no longer has like a nutritional supply to the rest of the body. Another part of root canal is that I'm sure you know about the Chinese system that says that you have a lot of meridians that run throughout your body. So what happens is this in Chinese medicine, this connects to a particular organ, it connects to a particular joint, it connects to a particular endocrine system, so it connects to a particular gland, so it connects to a whole lot of different parts of your body energetically. So what ends up happening is, if you are, if you're a proponent of that, what ends up happening is that now this tooth starts to affect that part of the body, if you're a proponent of that. So you really have to be, there's something to be said for Chinese medicine, and there's something to be said about the energetic things that happen in our body. So what ends up happening is then, these, let's say for example, these teeth over here are connected in men, they're connected to the prostate. In women, they're connected to the ovaries. So you then have to be very careful. You have to look at that patient and see that if this patient has like a root canal here and is also having prostate cancer, is that an issue? Is that something that you might want to deal with? Or did the prostate cancer cause them to have a problem with that tooth? Or did the tooth cause the problem with the prostate cancer? So it's one of those things that if you if you really don't have to deal with it, we really try to get our patients to stay away from root canals, because what ends up happening is it kind of like opens a whole box of different things that could potentially happen with your tooth. So what you want to do is really stay away from it. And if you do already have a root canal, well, what do you do if you already have a root canal? You know, you can't really, I wouldn't tell somebody, let's say they had a root canal on this front tooth here. Let's say she's a 26-year-old female, attractive. I wouldn't tell them, you know, you got to take that out and you got to put another tooth in there. I mean, that's just kind of like very traumatic. So you really kind of have to like balance that out. You know, if she's not having any symptoms, there's no really kind of issues, then how do you do that? One of the things that we do sometimes is you can put some ozone treatment over there. Ozone is something that we use at our office. Ozone kills bacteria, it kills viruses, it kills mold, it kills just about everything, but it doesn't have a toxic effect on our bodies because of it affects the cell wall of those organisms. Our cell wall is different. So that's one of the things that you can do, is to kind of like fumigate it with some ozone, or you can just monitor it. Make sure that no symptoms develop from that. Make sure that everything is okay with that patient. But root canals are something that's pretty standard in traditional dentistry, and you know, even sometimes in holistic dentistry, there's some holistic dentists that do root canals. They use different types of materials, but they still do root canals. So that's one of the things that you wanna kind of like really be aware of when you talk about that.